Hello, this is your Congressman Michael Burgess. Last month, Secretary Alex Azar was confirmed as the Secretary of Health and Human Services. In this role, Secretary Azar is at the helm of our nation's efforts to improve health care for the American people. Last Thursday, the Energy and Commerce Subcommittee on Health heard from Secretary Azar for the first time. We discussed President Trump's proposed budget for the Department of Health and Human Services, and particularly the need to focus our investments to meet the needs of a rapidly changing world. During the hearing, Secretary Azar outlined his plans to combat the ongoing opiate crisis. He outlined his plans to treat mental illness and advance health care reform. This is what he said, quote, "A Washington-centric, one-size-fits-all approach to health care, especially in insurance markets most affected by Obamacare, is simply not working and must change," close quote. I agree with Secretary Azar that we must work to create patient-focused insurance markets and give Americans more choice in their health care. Although Obamacare's burdensome individual mandate was repealed as part of the recent tax overhaul, we still have work to do on this important issue. Secretary Azar also discussed his objectives on bringing down drug prices and improving Medicare and Medicaid systems. These issues are important to North Texans and Americans across our country. Over the last few years, Congress has passed important laws to make health care more innovative and more effective. For example, just over 1 year into the implementation of the 21st Century Cures Act, we are already seeing this landmark law pay dividends for the American people. The Department of Health and Human Services must work to ensure that laws like the 21st Century Cures Act are implemented to their full potential. The leader of this department must be accountable to Congress and the American people for important work. Additionally, I discussed with the Secretary the need for relieving burdens on doctors and nurses, burdens which are aggravated by complicated payment systems and electronic health records. As chairman of the Health Subcommittee, I'm looking forward to partnering with Secretary Azar on our shared goals to improve health care for American families in North Texas and across the nation. After both meeting with Secretary Azar after his confirmation and in this first hearing before the subcommittee, I'm confident that he has a strong vision to deliver on the issues that matter most to all of us. I know we have a lot of work to do, and I remain committed to completing that work on your behalf. To that end, I hope to share more updates as I am able. As always, I appreciate your comments, your concerns on this issue or any other issue. May God bless you and your family. God bless our first responders, and as the song says, God bless you, Texas.